But artificial intelligence, it really does touch a lot of things, including mental health. And here to talk with us today, we are really excited to have her in the room. We have Elena Schexnider with NAMI, with the National Alliance on Mental Illness, here with us here today. Thank you so much for being here, because today is not just any day, it is also World Suicide Prevention Day, Elena, and you guys do a lot of work in this space. So let's start here. Because we just finished off with artificial intelligence, I want to start with a question on that.
Okay.
We've seen reports and we've seen some studies about the impact that social media and even now AI recently has had on youth and other people when it comes to suicide, their mental health. Are you guys seeing anything on your end from the expertise level, looking at the links there, and any tips for people if they're navigating the space of utilizing AI or social media?
That is a very loaded question.
It was.
I appreciate it, and I'll do my best to answer. There have been a lot of studies that show that social media can negatively impact youth mental health. And as you mentioned, we've seen news articles and media about, suicides that have occurred, and it's pretty alarming. AI is complicated, and I don't want to be black and white with it. I think that there are some benefits to having AI, especially with coping skills. I actually attended a conference at the end of August, and it talked about using ChatGPT to create a mental health toolbox, to ask it for journal prompts, and if you needed a breathing exercise, or if there was a specific type of skill, whether it's like DBT or cognitive behavioral therapy that you needed. And so in that way, I could see it being beneficial, but again, it's having that balance, and it's scary to kind of navigate, especially for parents and for educators who are trying to support their kids and youth to be resilient and to use it in a helpful way.
Today we mentioned is World Suicide Prevention Day. Where are we right now when it comes to maybe some of the statistics or numbers? I know when we were in the heat of the pandemic, that it got really, really, really bad. And there was a lot of conversation about that. Have we sort of level set? Are we seeing any spikes? Where are we now when it comes to suicides and then the resources for suicide prevention?
I will say that, I started volunteering with NAMI back in 2018. Actually, I became an official member on September 11th of 2018. And I have seen a huge growth in the amount of resources and just getting the conversation started surrounding mental health. And when COVID hit, it just skyrocketed because, as we talked about earlier, I had people coming up to me who they'd say, I've never been anxious my entire life, and I don't know what to do with this. How am I supposed to live with all this anxiety? So it helped to really break the stigma, and we saw an influx of resources, new programming. 988 was launched in 2022, so it was great. And today, the suicide rates, the statistics are still alarming. We were talking about LGBTQ youth in general. They're more likely to be diagnosed with a mental health condition than heterosexual youth. But suicide is still on the radar, and suicide is still something that we need to continue to work on.
I'm glad that you brought that up for LGBTQ youth. One of the big changes that recently took place, I believe in July is when the official change took place. There was, in the last 3 years, a specific number or section within the 988 suicide prevention line that geared towards LGBTQ youth and transgender youth. Well, that has now been taken away. The administration said the funding had run out. They ended that in the last few months. So let's start with, for those who may not know about that, what it actually provided for anyone who called, and how it may have been different if I'm someone who calls and I go towards that particular option within 988, and was it helpful?
Right. So 988 was launched 3 years ago, and the cool thing is with 988, you can call it, you can text it, you can chat online, and I've used 988 in the past a couple of times, and it's been helpful. And they had options, and they still do have, if you're a veteran, there's an option to talk to someone. I believe it's option 1. And then recently, like you mentioned, option 3 was specifically for individuals who identified as LGBTQIA+. And so, yep, the funding ran out and they got rid of it. Anyone can still use 988, but it's different when you have someone on the other side who understands you in a way that other people may not. And it's important to have somebody with, whether that's that lived experience that they may have as identifying as LGBTQIA+, or they have specific training for that, just to feel comfortable to open up, because it's a very vulnerable space to be in when, number one, you're in the midst of a crisis, a mental health crisis, whether it's mental health or substance use. But then number two, it's that extra level of vulnerability because, you're opening up about your identity and how it's impacting your mental health. So there are still, I want to leave folks with the resources, that there are still resources that are available if you do identify as LGBTQIA+. So there's the Trevor Project, which is for youth. There's a Trans Lifeline as well. You can call, go online. And I recently found this really cool storytelling website for youth. It's called itgetsbetter.org. So I just want to leave people with that you are not alone, that there's still stuff out there, and you can still utilize 988. It's just they've gotten rid of that specific option. And I'll say I'm a big advocate for allyship in any space. And I think it's up to us as citizens and community members to advocate for resources that are reflective of our community and have that flexibility.
As Naya has greatly put on a list of various resources, phone numbers, that is on the NAMI Coastal Virginia website right now, where if you go to NAMI Coastal Virginia, it has a list of things there for you readily available in the case that you're experiencing a wide variety of situations regarding mental health. I know I've had conversations with your team before, and they have told me that the scope of what the group works with is so vast. You all are doing a lot within the community, and we certainly appreciate it. You gave a few resources for people, which I'm really glad that you said that. And I just wanted to kind of talk about 988 real quick, because you're right, it really has been a lifeline. 16 million calls, texts, or chats within that 3-year span. Wow. And that's a lot there. And I'm seeing here that 10% of that, according to some of the data there from the government, were gay, trans, young people. Yeah. And so, a lot of people have been utilizing it, and you think about it, like all the lives that potentially have been saved just by being able to have a professional or someone to talk to. It can go such a long way.
It really, really can. It can. And, NAMI, I love NAMI. I could talk about NAMI all day. But one of the great programs is we have a connection support group. And oftentimes people go to the support group and they may not say anything. They just want to be amongst other people who have that lived experience. But then you have other people who feel comfortable opening up and talking about their mental health journey. And sometimes it's like they just need to get it out. Yeah. So Yeah, most definitely. Getting it out and talking about it breaks stigma, and it's a great way to, feel empowered.
And what would you tell to anyone who has a loved one, a friend, who they suspect might be in the moment struggling with their mental health or could use some extra resources, but maybe in themselves at the moment they don't have that push, or they maybe are fearful of moving forward? What would you tell them in encouraging and helping their loved one get the resources that they need?
I would say, do not be afraid. You do not have to carry it by yourself. I talk to a lot of people who feel that if they mention the word suicide to their loved one that they're concerned about, that they may actually take action. And that's not true necessarily. If you're worried about somebody, bring up the question, are you thinking about taking your life? Also, you don't have to do it alone. I like to think of myself as a peer, as a sort of like conduit. It doesn't stop with me, but it does take being able to recognize the warning signs and having that communication for sure.
Well, while we have you here, what are the warning signs? I mean, I appreciate you saying that, because you are so right. Sometimes it can feel, when you suspect that someone is going through that S word is something I cannot say, because, it's a conversation maybe that I feel as though I don't have the depth to get into, or I believe that they might actually start thinking about taking another step. So what are the signs that I should look forward to really kind of know, hey, I need to say something?
Oh, there's so many. It's such a good question. So isolation is a big one. People may tend to stay to themselves. They may cut their phones off. Another one is changes in eating habits. Maybe they stop eating, you've noticed, or they've drastically lost weight, or they're overeating. Substance use, if they've been using a lot of substances lately. Even changes in appearance. I always used to, when I was going through my mental health journey, before things got really bad, I would dress up and look so cute going to school. And then when my depression hit, I didn't care about my appearance and my hygiene. So that's another one. Taking risky actions, risky behaviors is another one as well. There's so many warning signs, and it's great to kind of, if you can, create a crisis plan and let those around you know, like, hey, when I start isolating, or if I don't answer my phone, please check on me, and letting other people hold you accountable.
Well, Elena Schexnider with NAMI, thank you so much, not only for coming on to this program, but also for all the work. I enjoyed our conversation before we started and hearing your journey, and I guess since we're a day early, happy anniversary for you and joining NAMI as well, since you said you started on September 11th, 2018, correct?
Yeah.
So, the work that you're doing is so important to help people within our communities here in Hampton Roads and abroad. So we certainly want to say thank you for that. And thanks for coming on and talking about this very important issue on a day like today, but any day. It's something that we should be talking about.